In the morning, we do the consultation with our patients and we do our patient's plan about operation. And the operation has three parts. In first part, extraction part. Second part is incision part. And the final part is the implantation part. And after that, we will check our patients and then after the operation in the first wash. And after the operation, they go to the hotel and they can have a rest. After the operation, they come back to the hospital, and after washing, our doctors check our patients' hair and implanting and donor area. In our clinics, we have approximately 10 and 15 patients in a day. I see commonly 3 or 4 patients in a day.